Have you ever worn too small shoes? Your toes are scrunched, blisters start to form, your feet hurt when you walk. The hazards of ill-fitting shoes exist. Even with shoes that are too big, there are still health risks. The website Very Well Health states that people are almost always wearing poor-fitting shoes. But what are some of these health hazards? When your shoes are too tight, you risk corns and calluses. Corns and calluses are hardened layers of skin that develop when the skin tries to protect itself from friction and pressure, says Mayo Clinic. Mayo Clinic also explains that calluses and corns are not the same thing. Corns are smaller with a hard skin that may also be inflamed. Corns can cause discomfort when walking or when pressed down. Calluses are not painful. They develop on the soles of your feet and are also larger than corns. There are also problems that can come up with your toenails. A neck doctor explains that some of these fungal infections, such as athlete's foot, can be prevalent. This can be caused by tight-fitting shoes. There are also long-term problems. Neck doctor also has a list of these long-term causes. Collapsed arches can happen when you're wearing too big or too small shoes. A lack of support for your feet can lead to these long-term health hazards. Back pain and joint pain can both be chronic, which also comes from the lack of support. Foot deformities can also be a problem with too small shoes. OrthoInfo discusses bunions and hammer toe. A bunion is an enlargement of the bone, normally at the base of your big toe. As the bunion grows, your toe will turn inward towards your second toe. This can and will cause problems when walking, along with pain and swelling. Hammer toe is when your toes stop laying flat and curl in. This will cause your toes to rub against your shoes and may cause pain and blisters. There are plenty of health issues that are caused by too small shoes. But what about oversized shoes? Shoes that are way too big for you can lead to blisters. Blisters form when a spot is rubbed too long. An example would be the back of your shoe slipping up and down as you walk. But what exactly are blisters? WebMD tells us what blisters are. Blisters are small pockets of fluid underneath the skin. They can be filled with pus, blood, or serum. They form to create a barrier between the shoe or object, causing friction. You can also lose toenails, and bunions are also common with oversized shoes. Another hazard of oversized shoes is the fact that you can trip. Tripping can lead to broken bones, scrapes, head injuries, and severe bruising. Finding shoes that fit can be hard. People with diabetes have to have shoes that fit properly. Diabetics tend to have swollen feet, but also need proper fitting shoes for blood circulation. Diabetics have complications such as neuropathy or nerve damage. During life, your shoe size fluctuates. Your muscle relaxes, your feet spread, and even an overdose of hormones can make shoe size changes. During pregnancy, women tend to see more swelling due to your feet having the possibility to retain water. The American Podiatric Medical Association took surveys about painful elements in poor-fitting shoes. There were 1,082 responses. 68% said that poor-fitting shoes caused blisters. 58% had heel pain, 32% had ingrown toenails, 26% had corns, and 17% had pinched nerves. People need proper fitting shoes. You can risk health hazards. From blisters to deformities to foot fungus, poor fitting shoes can and will ruin your life. So do better. Get your feet measured and find shoes with the correct support for you.